Hello friends, welcome back. In this session we are going to discuss about radiological age estimation from the knee joint and the ankle joint. Myself Dr. Srinivasan from Chettinad Hospital and Research Institute, Chennai. Let us start with the knee joint. Here there are three centers to look for. One for lower end of femur and second is upper end of tibia as well as upper end of fibula here. Lower end of femur that appears at the 9th month of intrauterine life, whereas upper end of tibia appears at the 10th month of intrauterine life. It is better to use the 10th month of intrauterine life, as sometimes if the fetus is born prematurely, that is by 8th month or 9th month, it won't be there. So it is better to use the term 10th month instead of full term fetus. Then upper end of fibula that appears by 4th year. All these three centers fuse with the diaphysis by 18 to 19 years. In the first part of this video I told ankle joint fusion 16 to 17, then from there you have to move to hip joint where the fusion occurs at 17 to 18, then from there come to finally knee joint where the fusion occurs between 18 and 19 years. In this we can remember by T for 10, that is for 10th month of intrauterine life, whereas for fibula F for 4, that is 4 years is the appearance age. This is in the cross examination. You can see the lower end of femur that is appeared but not fused here. Similarly, upper end of tibia appeared not fused. Fibula appeared not fused. In the fetus, by serial sections on the lower end of femur, we can appreciate the appearance of ossification center. So the ossification center like this is present in the center. It means the fetus has attained the age of 9th month. So in the X-rays, these are the three centers, lower end of femur. In this X-ray, you can see this is the point where or region where this epiphyseal or growth plate lies, right? If there is radiolution shadow, this lower end of femur has not fused with the shaft. So it has definitely appeared but not fused with the shaft. Similarly, below the lower femur, you can see the tibia, that is upper end. Again here it is appeared not fused. Similarly, lower end of this upper end of fibula, this has appeared not fused. This is the joint space. Don't confuse the joint space with the epiphyseal or growth plate, as both are radiolucent, right? This is the joint space. This is the region where you have to look for the fusion occurred or not. Let us come to the age estimation. In this knee joint X-ray, there is small radiopaque shadow below the lower end of femur, that is the epiphysis for lower end of femur has just appeared. Tibia upper end, nothing is here, so not appeared. Similarly, upper end of fibula also has not appeared. So what is the age? Since the lower end of femur has appeared and upper end of tibia not appeared, age is more than 9 months and less than 10th month of intrauterine life, or simply we can say 9 to 10th month of intrauterine life. So lower end of femur. In this X-ray of knee joint AP view, you can see the lower end of femur has just appeared and but not fused here. Upper end of tibia also appeared, not fused, but fibula has not appeared at all. Here there is no radiopaque shadow. Similarly, here also fibula not appeared. Here also you can see the fibula not appeared. So what is the age? Since the lower end of femur, upper end of tibia, which are this upper end of tibia appearance 10th month of intrauterine life. So age is more than 10th month of intrauterine life. Since upper end of fibula not appeared, age is less than 4 years. So age is above 10th month of intrauterine life but less than 4 years. So in this X-ray of knee joint left side AP and lateral view, you you can see the lower end of femur appeared not fused. Upper end of tibia appeared not fused. Upper end of fibula also you can see a small part here appeared, but it's definitely not fused here. Here also you can see the upper end of fibula appearance and non-fusion. In this X-ray also you can see upper end of fibula appeared not fused. Lower end of femur, upper end of tibia, and all the X-ray you can see not appeared not fused, right? So what is the age? Since the upper end of fibula is the last one to appear, age is above 4 years. Since all the fusion occurs between that 18 to 19 years, age is less than 19 years, right? So above 4 years but below 19 years should be the age here. Here you can see the upper end of fibula appeared not fused. In this X-ray of knee joint, AP view, lower end of femur appeared. This is a line of fusion, right? Fused, tibia also fused, fibula also fused. Here the fibula fused. Here in this X-ray also fibula fused, upper end. So age is above 4 years since the fibula has appeared. Since all the centers have fused, now age should be more than 18 years, right? Take the lower limit. Once the event has occurred, as described in the first part of this video, we have seen that since the event has occurred, age should be kept as the lower limit. Once the event has not occurred, go for the upper limit. Since the fusion, that event has occurred in all the three centers, take the lower limit, that is age is above 18 years. You should not say age is above 19 years, right? Moving on to ankle joint. Here there are multiple centers like wrist joint. We will see for lower end of tibia, fibula, there are centers. Then where they articulate the talus and the navicular, then lateral, medial, and intermediate or middle cuneiform. Coming down, the calcaneum or calcaneus, then cuboid, so articulate to base of these fourth and fifth metatarsals, right? Whereas these cuneiforms articulate with each of these first three metatarsals, right? Then base of first metatarsal, heads of second, third, fourth, and fifth metatarsal, similar to heads of metacarpals we have seen in the wrist joint. So there are two centers, one for lower end of tibia and other for lower end of fibula. Both appears at 1 year. Fusion also both fuses at 16 to 17 years with the respective diaphyses. Coming to tarsal bones, calcaneum or calcaneus, it is the only tarsal bone found by both primary as well as these secondary centers, right? The primary center for calcaneum forming the main part of this calcaneus appears at the 5th month of gestation, whereas the secondary center appears after birth, that is at the posterior part of this calcaneus. There is a crescent shaped part that appears between 6 and 8 years. Fusion occurs at 14 to 16 years. In the elbow joint, we have seen medial epicondyle appears at 5 to 6 years. The fusion occurs with the diaphysis, which fuses separately, that is between same 14 to 16 years. If you remember that calcaneum also, you can remember same 14 to 16. There it is appearance 5 to 6, here 6 to 8 years. So calcaneus 5, 6, 8, 6 plus 8 is equal to 14 years. So 14 to 16 years is the fusion for calcaneus, right? Then moving on to this talus bone, that is appearance by 7th month of intrauterine life. Then cuboid, 9th month of intrauterine life. This is the talus, which is the cuboid, right? Above top is the talus. So talus, 7th month of intrauterine, most important bone, because at 7th month fetus is said to have attained viability once it crosses 7th month or 28 weeks of gestation or 196 days, which is the normal period of viability. So the talus bone is present, it means the fetus has attained the age of viability, which has its medico-legal importance. So cuboid nearing full term, it generally appears at the 9th month of intrauterine life. Some books it is given as 10th month also, right? As I said, among these tarsal bones, like coracoid there and capitate in the wrist joint, all whatever center starting with the C, they generally compared to other centers they start earlier. Here also in this tarsal bones, calcaneum, the letter C, like capitate or in this capitulum, it calcaneus also start early here, 5th month of intrauterine life for primary center. Then navicular appearance 3 years. Then lateral cuneiform 1 year. L for we can remember as 1 year, similar to lateral epicondyle, where 2 L's for lateral epicondyle, lateral, right? LL for we have remembered 11 years there. Here for lateral we can remember 1 year, right? Then medial cuneiform 2 years, lateral 1 year followed by medial cuneiform 2 years. Lastly, the intermediate cuneiform or middle cuneiform 3 years. 1, 2, 3 we can remember. So navicular also 3 years, intermediate cuneiform also 3 years. Then base of first metatarsal appearance 2 to 3 years. Heads of second to fifth metatarsals 3 to 4 years. Fusion 18 to 20 years. Similar to this base of first metacarpal, base of first metatarsal also same 2 to 3 years. There the heads of metatarsal 1.5 to 2.5 years. Here it is 3 to 4 years. There the fusion occurs at 15 to 17 years for base of first metacarpal, then heads of second to fifth metacarpal, 16 to 18 years. Here 18 to 20 years. 15 to 17, 16 to 18. Here it is 18 to 20 years, right? So with this, I want to tell here, generally all the tarsal bones are formed by the primary ossification center, which usually appear in the intrauterine life. These naviculars, cuneiforms, they appear after birth. So this is a exception to the general rule. So with this, we move on to see this age estimation. In the gross bone, you are seeing here the lower end of uh, tibia and the lower end of fibula both have appeared, but not fused, right? So which is this is the epiphyseal or cartilaginous part, right? Epiphyseal plate. So in the X-ray, you are seeing the lower end of tibia and the lower end of fibula both have appeared, but not fused. Here also tibia as well as fibula have appeared, not fused here. Then moving on to tarsal bones, this is the calcaneus. The major part is found by the primary center, which appears at 5th month of intrauterine life, whereas at 6 to 8 years, the secondary center like a crescent part in the posterior it appeared. It has not fused, right? So this secondary center is important for age estimation. Once it appeared, age is above 6 years, not appeared less than 8 years. If it is appeared and not fused, as you are seeing here, so age is above 6 years. The fusion occurs, as I told, 6 plus 8, 14, 14 to 16 years. So age is above 6 years, less than 16 years. This is the sandy center for calcaneus. You are seeing in the X-ray as like a crescent part, which is a hyperdense part. Here also appeared, not fused. Here also appeared, not fused. In this adult, you can see this sandy center for calcaneus has appeared as well as fused. So fusion occurs at 14 to 16 years. So age should be more than 14 years here. Here above 6, less than 16 years. In this X-ray, you are seeing the sandy center for calcaneus has not appeared. So there is no hyperdense and projection like these are missing here. So under this border also you can see somehow rugged or uneven. If it is having a smooth contour like this, it means it has appeared as well as fused. If you can see a rugged or uneven contour here, that means secondary center for calcaneus has not appeared, right? This is how whether appear, not appeared, or appeared and fused we can differentiate, similar to we have seen in the iliac crest appearance and diffusion, etc. So in this X-ray, as you are seeing in the calcaneus, primary center has formed, but the secondary center has not appeared, as you are seeing this rugged contour here at the posterior part. That means it has not appeared. So age is less than 8 years, right? Here appeared, not fused. Here also appear, not fused. You can see somehow a thin radiolucent shadow in this area, right? Even if you see minimal radiolucent shadow like this, you have to take for exam purpose as not fused, right? Appeared, not fused. Above 6, less than 16 years. Here also above 6 years, less than 16 years. So here also it is not fused. If you observe closely, you can see the non-fusion radiolucent shadow, that is the epiphyseal plate. Here you can see a hyperdense, the smooth contour, right? A hyperdense shadow on the posterior part, a crescent shape with a smooth surface. That means it has appeared as well as fused, right? So secondary center appeared and fused age should be above 14 years, right? Now determine the age now in this X-ray. So lower end of tibia as well as fibula both have not appeared. So age should be less than 1 year. Only two tarsal bones are there. Primary center for calcaneus has appeared above 5 months. Talus appeared above 7th month. But next one, what you are expecting here, that a cuboid has not appeared here in the left X-ray, which appears by 9th month. So age should be more than 7th month of intrauterine life, but less than 9th month of intrauterine life. Here the lower end of tibia as well as fibula not appeared, less than 1 year. Three tarsal bones are there: talus, primary center for calcaneus, as well as what is this cuboid bone. So more than 9th month, this is the last one now. This is the 5th month, talus 7th month, cuboid 9th month. More than 9th month of intrauterine life, right? Less than 1 year we can say, as the lower end of both tibia and fibula not appeared. More than 9th month of intrauterine life, less than 1 year. In this X-ray, you can see both the lower end of tibia as well as fibula has appeared, not fused. So more than 1 year, here less than 17 years, right? Ankle joint 16 to 17 is the fusion. There are talus, calcaneus, cuboid, right? Lateral cuneiform, middle cuneiform, medial cuneiform, navicular, all have appeared. Base of first metatarsal also appeared, not fused. So age is about 3 years. Here navicular has appeared. Secondary center for calcaneus not appeared here. So age should be more than 3 years, as navicular. Navicular and intermediate cuneiform both have formed more than 3 years. Less than 6 years because secondary center for calcaneus has not appeared. So in this X-ray you are seeing the multiple tarsal bones, right? So lower end of tibia has appeared, not fused. Lower end of fibula, both the X-rays have appeared, not fused. Base of first metatarsal appeared, not fused. Heads of second, third, fourth and fifth, like here, second, third, fourth, fifth appeared, not fused. Secondary center for calcaneus has appeared, but not fused. As you are seeing here, this is the line of fusion. And both the X-rays you can see there is a thin radiolucent shadow between the secondary center and the main body of calcaneus, right? So that means it has appeared more than 6 years, not fused, less than 16 years, right? Secondary center for calcaneus appeared, not fused. If you zoom and check, you can see a thin radiolucent shadow between the sandy center and the main body of calcaneus. Then now coming to other tarsal bones, this is the talus, more than 7th month of intraventricular life, appeared. This is the cuboid, appeared more than 9th month of IUL. Medial, this is the medial cuneiform, appeared more than 2 years. Middle or intermediate cuneiform appeared more than 3 years. Lateral cuneiform appeared L for 1, that is this is the lateral cuneiform, appeared more than 1 year. Navicular appeared more than 3 years, right? So what is the age here? Since these heads of 4 metatarsals, navicular, you know, uh, and this intermediate cuneiform all appears by 3 years, more than 3 years. But here the scientist center has appeared, so age is above 6 years. Since the scientist center not fused, age should be less than 16 years. So above 6 and below 16 years should be the age here. Coming to this X-ray, you are seeing this lower end of tibia, lower end of fibula, right? Tibia has appeared, fibula also appeared as a small dot here, so age is above 1 year, but they have not fused. Talus appeared, primary center for calcaneus appeared, sandy center not appeared, more than 5th month talus, more than 7th month, this is a cuboid, more than 9th month of intrauterine life, right? All more than 9th month. This lateral cuneiform also appeared more than 1 year, right? More than 1 year lateral cuneiform appeared, but this medial cuneiform not present here, so which appears by 2 years. That should be the next event, right? So age should be 1 to 2 years. 1 year because lower end of tibia, fibula as well as this lateral cuneiform has appeared. Since the medial cuneiform not appeared, which happens at 2 years, age should be above 1, less than 2 years. In this X-ray, the primary center for calcaneus has appeared. There is no hyperdense shadow here. Sandy center not appeared. Talus appeared. Navicular appeared. Cuboid appeared. Medial, intermediate, and lateral cuneiform. So 1, 2, 3, 4, 5, all 7 carpal bones have appeared. But the sandy center has not appeared less than 8 years, right? Base of first metatarsal appeared not fused. Heads of second, third, fourth, and fifth metatarsals also appeared. So it is more than 3 years here also. So age should be more than 3 years, but less than, that sandy center for calcaneus not appeared 8 years. So more than 3, less than 8 years should be the age here. Here lower end of tibia has appeared, not fused. Lower end of fibula appeared, not fused. Primary center for calcaneus appeared. Sandy center for calcaneus not yet appeared here. Talus appeared. This is the cuboid, and the lateral cuneiform appeared, but medial and intermediate cuneiform navicular not appeared. So as far as tarsals, less than 2 years because the medial cuneiform not appeared, but the base of the first metatarsal appears, which also appears at 2 to 3 years. But heads of second, third, fourth, and fifth metatarsals not appeared here. So age is, we can say, more than 2 years because base of the first metatarsal appeared. Less than 3 years because this intermediate cuneiform and navicular not appeared. So we can say age is between 2 and 3 years or 2 to 3 years, like that. But the medial epicondyle, in the situation which should have appeared by 2 years, not appeared here. In case of confusion like this, check for X-rays of other joints of the child to confirm the proper age. Then here in this X-ray you are seeing lower end of tibia appeared not fused, lower end of fibula appeared not fused, primary center for calcaneus appeared, but secondary center for calcaneus not appeared. Talus, this is the cuboid, this is lateral cuneiform, intermediate cuneiform, medial cuneiform. So 7 tarsal bones are here except navicular. So age is less than 3 years as navicular not appeared here. But base of the first metatarsal appeared more than 2 years. Heads of second, third, and fourth metatarsals, if you observe closely, you can see they have just appeared. But head of the fifth metatarsal not appeared. Since all these four heads of the metatarsals appeared between 3 and 4 years, since the head of the fifth metatarsal alone not appeared, we can say the age is 3 to 4 years. As heads of all the four these metatarsals appear between 3 to 4 years. So same age we can keep as the range here. But if you are saying 3 to 4 years, but navicular has not appeared here. Again we have to confirm in the child other joints x-rays to properly fix the age range. In this you can see this base of first metatarsal appeared not fused, heads of all the four metatarsals appeared not fused, lower end of tibia fibula appeared, talus appeared, primary center for calcaneus that has appeared, but the secondary center not seems to have appeared here, right? But all this cuboid, lateral, middle and medial cuneiforms, navicular all have appeared, but secondary center for calcaneus is not developed here. So age should be, above 3 years because of heads of metatarsals 4, that is 4 metatarsals, navicular, middle cuneiform or intermediate cuneiform more than 3 years, less than 8 years because secondary center for calcaneus not appeared. In this X-ray you are seeing this secondary center for calcaneus appeared as well as fused, right? Lower end of tibia fibula also appeared and fused, right? Base of first metatarsal and heads seems to also have fused, which is the fusion occur here, say heads of the metatarsal only, which is 18 to 20 years. So age should be above 18 years, right? Here also you can see definitely a hyperdense shadow, that is anti-center for calcaneus appeared as well as fused, right? So age is above 14 years, lower end of tibia fibula all fused, above 16 years. All the carpal bones are seen. Base of first metatarsal appeared and fused. Heads of second, third, fourth, and fifth metatarsals also appeared and fused. So this is a fusion to occur late. So 18 to 20 years. So age should be more than 18 years, since all the heads of these second, third, fourth, and fifth metatarsals have appeared and fused. Above 18 years should be the age. Here also we can see this adult X-ray of the foot lateral view. You can see this secondary center for calcaneus appeared and fused. All the tarsal bones appeared. Lower end of tibia fibula appeared and fused. Base of first metatarsal fused. Heads of second, third, fourth, and fifth all have appeared and fused. So age should be above 18 years, as heads of second, third, fourth, and fifth metatarsals are the last one to fuse here. So with this I come to the end of this video. I would like to give a recap of these some Viva questions here. So main Viva part should be well prepared about the medical legal importance of various ages, including the intrauterine ages. Certainly you may come across the question what age you derived for the particular X-ray. The examiner may ask you the medical legal importance of that corresponding age. So you should have been mentally prepared for these things. Then as far as this ossification is concerned, there are two types of ossification, that is primary, that is a intramembranous ossification, and the this endochondral ossification. Then ossification centers are primary ossification center and secondary ossification centers. Coming to this age estimation, uh, this reliability is more for ossification age compared to dental age, right? Then as far as this appearance and fusion of ossification center is concerned, aging is more reliable compared to appearance of ossification than the fusion of ossification centers. So appearance is more reliable than age is, as far as this aging of the individual is concerned. Coming to various factors influencing the ossification, it can be determined by the race, sex, metabolic disorders, infectious diseases, nutrition, health, hereditary conditions, all these. As far as the sex is concerned, females, this skeletal development is in advance of the male compared to 1 year, especially the fusion age of these various ossifying centers is compared to males, they are in advance or occurs early in the females by 1 year. Whereas for dentition, again females, it happens yearly by 1 to 4 months, various eruption of teeth compared to males. Secondary sexual characters development also occur in advance in females by 1 year compared to males. Whereas only factor where this in females delay occurs is with respect to the fusion of cranial sutures like sagittal, coronal, etc. that occurs early in males by 1 year compared to females. This point you have to remember. As far as this climate influence this uh, ossification, especially the fusion and all, occurs earlier in the this tropical climate compared to temperate climate. India being a tropical country, it occurs 2 years earlier compared to the temperate zones. Then once a fusion starts, it takes 12 to 18 months to complete. That is for full fusion occur, it takes 18 months. It starts, so roughly around between 12 to 18 months for complete fusion occurs once the fusion starts. Then there are around by 11th week of intrauterine life, around 806 ossification centers are there. At birth it will become reduced to 450. Then finally only 206 adult bones are there. So remaining 600 centers, they disappear by merging with the adjacent centers to form the definite adult bone. So these are the certain viva topics we should be knowing. Then as far as this radiological versus anatomical union, radiological union is generally in advance of the anatomical union by 6 months, because towards the end of growth period the epiphyseal plate becomes too thin and irregular, and we cannot appreciate in the x-ray. The x-ray very narrow or thin this epiphyseal plate at the end of growth period will look as if it is fully fused. So generally it will be 6 months in advance compared to the anatomical bony union, right? So with this I conclude this radiological age estimation for various joints. If you have doubt, you can ask in the comment section. Thank you.